was an afternoon. I still remember very clearly when Mrs. Saswan walks in with her husband and Sanaullah as a translator. And then I just went to a couple of records of hers, and there I found that she had 3 IVF cycles failed over there. She was 36 years old, and the reason for doing an IVF was a male factor infertility. When I did an ultrasound, I found that there was something wrong in the uterus. And when we did an hysteroscopy, as I had guessed, it was a midline partition inside the womb, which I failed to understand how could it have been missed in the previous past IVF cycle.
We had tried the IVF procedures back home in Baghdad, Syria, Kurdistan, but it was of no good. The doctors told us that there was a 50% chance of a successful IVF in normal cases. But God knows where it was going wrong. I was dejected and lost all faith, not knowing whether the fault was in the medical procedure or in our destiny. There is a perception that India is ahead of even US and Europe when it comes to medical services. A family friend told us about Max hospitals, and hearing about the success stories of the IVF at Max brought that one ray of hope. We wanted to try it for the last time here.
My mother had purchased clothes for my kid, but she passed away a year back without seeing the face of her grandchild. This broke me. There were people who had gotten married when I did, and now had beautiful kids, and I had none. 10 long years and 3 failed procedures. I used to cry to myself.
On the day of the egg collection, the husband gave the semen sample, which was good but not appropriate for an IVF. So we used the advanced technology known as ICSI. And after that, we waited for a blastocyst culture. And then I transferred 2 blastocysts, and 2 weeks later, Sanaullah calls her and says, "Okay, madam, she looks positive."
I cannot thank God enough that we met Dr. Bhavna. She and her team of doctors are so good. This is such a homely environment, and we feel so nice being here. We are immensely grateful to Dr. Bhavna and the entire staff of Max Hospital, who gave us the support and care when we needed it the most, and made our dream come true.
The Max healthcare facility, which is got its USP as well as the doctors working into the healthcare, is that each patient is handled in a unique and a different way. It's like one protocol for one patient may not suit the other patient. So it's not a blanket treatment given for everyone. So each parameter is very subjectively assessed depending on the patient's ability to interpret the subject. So we spend extensive time with the patient.